Hey everybody, Dr. Hayes Estes here, Premier Physical Therapy and Sports Performance here in Clearwater, Florida. And we have another YouTube social media installment. And today we're going to talk about a misnamed diagnosis of tennis elbow or lateral epicondylitis. And we're going to kind of dive in a little bit to the research, and I'll tell you why that name is incorrect and what the actual indicated treatment is for this condition. So going as far back as about 2005, 2006, we actually started to see some studies. Stanisopoulos was one in 2006, and WAUGH was another in 2005, that suggested that we should stop calling this lateral epicondylitis and call it either lateral elbow tendinopathy or lateral epicondylalgia, which is just a term of lateral elbow pain. And the reason that is they did histological studies where they actually looked at the tendon that's usually involved, which is called your extensor carpi radialis brevis. They looked at that tendon, and there at the level of the tissue, there was no inflammatory characteristics that were found. On top of that, they found other sites that would refer to this area: cervical spine, peripheral nerves. And so if you look at the term tendinopathy, it's probably more appropriate because of it's something that is causing pain, apathy of the tendinopathy. And again, histological studies show that there were no actual inflammatory characteristics that were shown in that area. And so this has been going on for a while, but the clinical practice is still not quite caught up to it. So, and even systematic reviews around that time, Bissett et al. In 2005, showed that there was an ineffectiveness of anti-inflammatory medication, anti-inflammatory interventions like shockwave, phonophoresis. Those things had no effect on this condition, and that is because the tendon is not inflamed. It's not really an overuse injury in that aspect. So if you have been diagnosed with lateral epicondylitis, stop taking the anti-inflammatory medications, stop getting the cortisone injections, stop with the topical steroids, because those are not going to be effective with your condition. What's going to be effective is some combination of concentric and eccentric strengthening to the area. We know that eccentric strengthening, isometric strengthening has been shown to be appropriate, to be indicated for pain reduction. We don't exactly know what's happening with eccentric strengthening, but we know that it shows decreased pain, and it helps with laying down the tissue appropriately. When we have muscle reformation, the tissue then gets laid down appropriately, and we don't have development of scar tissue with eccentric strengthening. Again, because in this condition, we don't see the inflammation, but we see potential breakdowns of the tendon. So some combination of concentric, isometric, eccentric strengthening, potentially nerve glides. So you have nerves peripheral nerves that travel through this area, and they can become entrapped, and they can be causing some referred pain to this area here as well. So potentially doing some sort of nerve glides to improve the mobility of the nerve in that area, and to help reduce the pain. There has also been some studies by Vincenzo, I'm sorry I butchered that, that showed that doing lateral cervical glides in the cervical spine have shown to reduce referred pain, shown to reduce the lateral elbow pain, because of referred pain from the cervical spine can travel to the neck, to the shoulder, to the elbow, to the hand. So doing some treatment there could also be indicated. Who's going to be able to determine which you actually need? That's where we come into play. So a doctor of physical therapy can diagnose and treat this musculoskeletal condition. We can determine where the pain is coming from and what the indicated treatment is. So that kind of wraps up today's episode. Again, if you've been diagnosed with lateral epicondylitis, stop before you get that cortisone injection. Stop before you take the anti-inflammatory medications that are going to damage your liver, and come to see a doctor of physical therapy, and we can treat this conservatively and get you back on the road to recovery doing the things that you love. So as usual, if you like what you see, please like us, subscribe, share this with your friends, and find us here on Instagram. We are at Run Tampa Bay. We're on Facebook, Premier Physical Therapy and Sports Performance. We're here in the Clearwater area, and if you are looking to book an appointment, go onto our website, ptsportstherapy.com, and you can book an appointment straight from our website. And in the state of Florida, you do not need a medical doctor referral to start physical therapy. So hope you have a great day, and let us help you get back to doing the things you love.